Hello, my name is Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important and very interesting healthcare topics. Today we're going to talk about Northwestern Occupational Health, or NOH, and we have Doreen Benoit, a family nurse practitioner, and also Brenda McMahon, who is a director of the Occupational Health Program at NMC. So thank you both for being here today to talk about occupational health.
You're welcome.
You're welcome.
Yeah. So first off, just to ground our viewers, what is occupational health?
So occupational health is a service that helps keep workers healthy, either from a preventative aspect, giving acute care if somebody comes in injured, or making their workplace more safe.
Great. Excellent. So, and what are your roles and how long have you been doing those? So let's talk about you for a moment.
So I'm a family nurse practitioner. I've been a family nurse practitioner since 2001. I've worked here at Occupational Health for 6.5 years. And prior to that, worked at Children's Hospital in their occupational health department. But I've also done primary care, urgent care along the way.
Great, thank you.
Welcome.
What about you, Brendan?
I've been with NMC for 2 years, and I'm the administrative director of occupational health, so my responsibility is to manage the day-to-day activities and work with the companies to develop programs that meet their needs.
Excellent. So let's talk a little bit about the programs that you provide. So what are the services that you provide?
We provide multiple services, from injured worker care to on-site services tailored to meet the requirements of any specific industry, to work hardening programs that are designed to get somebody back to work quicker after they've been out of work for an injury.
So how long has NOH been in existence? How did this all get started?
So in 1999 is when occupational health first began here in St. Albans, and it's been going ever since. We have 2 sites. We have a site here in St. Albans in the Cobblestone building that's located behind the hospital. And then people can also be seen in Georgia at the urgent care site in Georgia.
And can you describe what work hardening is more?
Absolutely. So work hardening is a program that we work with an individual in a company when they've been hurt at work to get them back to work as soon as possible. What a typical session would look like is it lasts 12 weeks long, and the employee will see a physician or Doreen 1 day a week and participate in physical therapy in our rehab services department up to 4 days a week for 3 to 4 hours at a time, duplicating the movements and the work that they're doing at work underneath the medical supervision.
So do you provide services at those 2 locations, or do you go into the work site? What does it look like for business?
We can do whatever the business would like. We do have businesses where we are on site regularly. Doreen works with one of our companies when she's on site 2 days a week. We have nurses that go out to other companies. So it's really what our customers need and what they want for their workforce.
So Doreen, what does a typical day look like for you if you're at a work site one of those 2 days a week?
So when I'm at a work site, I meet with employees. Usually it's for injury management if they've been hurt at work, or even if they've had some sort of ailment that's causing them pain and their work is kind of aggravating it. So I just monitor them. If they need physical therapy, we can provide some physical therapy services on site. Otherwise, I get them referred out to the proper physician or other provider that would help them. And mostly, I'm just making sure that they're doing okay while they're working.
So do you do any prevention or worksite wellness type of activities? So you're there making sure folks who are injured are getting back in the kind of the groove of things, What do you do anything with the rest of the workforce regarding prevention work? Help them keep their employees healthy?
We have a model in one of the companies that we work with where we have a physical therapist go on site, and all that physical therapist does is walk around and talk to employees about ergonomics, the wellness, what can you do differently. So we do have models like that in some of our companies. And we also do flu shots and other preventative screenings, such as biometric screenings through lifestyle medicine that we also partner with at NMC.
So what are the most common services that you provide for your employers, would you say?
So we do a lot of acute care. When I'm working in the clinic, mostly it's acute care. Somebody has fallen, or somebody's hurt their back, or somebody has cut their hand and need to have sutures. So that's probably the majority of my day, managing their workers' comp case and making sure that we are keeping them in work, maybe in a restricted capacity, but they're still able to get up and go to work and do some sort of job until they're cleared for full duty. So that's really the goal, to keep people in their positions, and if they're injured, that we're giving them some restrictions so that they can still attend work. But that's probably the majority of my day. I see a lot of acute, and then a lot of follow-ups for the work-related injuries. We also do DOT exams as well for
What's that, DOT exam?
Department of Transportation. So exams for people, drivers, truck drivers and bus drivers. And we have guidelines we have to follow from the federal government that are pretty strict. So we do those as well.
And what does that entail?
So they come in and they have to provide their full medical history. They have to have a vision screen, a hearing screen. They have to give us a sample that we can check to check for blood sugar and protein and that kind of stuff. And then we do a physical exam to make sure that they're good to drive and safe to drive. And the other big piece of that now is making sure that they are not sleepy when they drive. That's a big thing that they're cracking down on. So we have to make sure that if they need to have a sleep study, we have to refer them out for that.
Okay.
Yeah.
So a lot about safety.
A lot about safety, absolutely. And a lot of things get picked up, and we refer a lot of people back to their primary care, and things are picked up that maybe they wouldn't have been with that exam.
Great. So it's sort of like a wraparound, even though you're working with the businesses and the employees, you're making sure there's good connection with their primary care provider to make sure you're really wrapping around them for the best care overall.
Yeah. It's basically a functional capacity exam to make sure that they're good to do their job, and if they do have other health issues that are not related to their job, we're able to get them set up with the right provider.
So if someone does have an acute injury, unfortunately, on the job, where do they go for that? Do they go to the emergency department? Do they call you? Do they go to urgent care? What's that system look like?
So typically it's, ideally the business would like them to come to urgent care. Sometimes the hours don't work out that way, and the person does have to go to the emergency room, if they're working a night shift or something and we're not open. But typically if that happens, the employee would have to report it to their employer, and then we have to get the okay to treat them from the employer, so that we're making sure that everything will be covered. And then we manage it from there, to make sure to get them back to work. So if they were seen in the emergency room, they always follow up in occupational health after that.
So it sounds like a real partnership between the business with occupational health and also the patient as well, to make sure that they're staying healthy, but if they get injured, they're doing the right things to get back to work safely.
Right. And it's also, we're sort of like the middleman between the employer, we care for the patient, but then workers' comp also comes into it as another piece.
Yeah, I'm sure you have a lot of guidelines to follow and making sure that people's benefits get engaged.
Exactly.
Yeah. So how is this program developed over time? You said 1999 it started, so Are you growing with businesses, or what's happening? How well are you serving the community here?
In 1999, we started to address the needs of a community. NMC stepped up and took that role to provide occupational health. Over the last few years, we've grown to have about 330 businesses on our client list that we're working with fairly regularly. So we're continuing to grow. Last year we grew 5%, and we service all levels of businesses. It doesn't matter if you're a small corner market with 2 or 3 employees, or you're a larger industry that we have in the St. Albans, Lincoln County areas.
And how would you describe this to businesses that maybe aren't a part of this? Why does someone need this type of service? Can't they just do it on their own?
We partner with the businesses to make sure that they're keeping their workforce healthy. Every single time somebody calls in sick or there's lost productivity, it costs an organization money, no matter how big or how small you are. We work with the businesses to lower their injury rates. Therefore, they can work with their insurance companies and lower their insurance rate also. So we do.
Great.
Our intent is to help them save money and keep a healthy, happy workforce.
Great. And I'm assuming with all those businesses, you've been somewhat successful with that,
We
helping
have.
the businesses.
Yep. We continue to grow. We're looking at new services to provide, and we continue to look at our program and make sure that we're staying in line with what the rest of the nation's doing, and we're working hard to keep people healthy.
And what's the most popular thing that businesses look for with your program?
We see a lot of drug testing coming through. So I would say that drug testing is popular, injured worker care is very popular, and pre-employment and post-employment screenings are also very popular.
Great, great. So do you have a success story or two that you might want to share?
We do. Earlier this year, a company reached out to us and said, you are doing wonderful with our injured worker care, and the problem is that we have too many injured workers. So we worked with them over a period of 2 months, and we identified what the root cause was and why they were having so many injuries. We instituted a program that included pre-employment screenings, and that reduced their injury rate by 32%. Specifically, what a pre-employment screening was is everybody before they went to work, before they were actually hired, they had to pass a physical with the provider and a pre-employment screening, which is working with our PT to simulate what they're doing in the work environment. So we were able to give them hiring recommendations based on the ability of individuals to do jobs.
Wow.
So they were very pleased with us.
Congratulations, that's awesome.
Thank you.
Yeah, that's great. I don't know, Doreen, you have anything else to add?
I don't think so. I think we covered a lot.
Okay.
Yeah. The pre-employment piece is a big part of what I do in my day too. I see a lot of pre-employment physicals, and we also do physicals actually for the state police. They come and see us for a lot of their annual physicals. So that's a nice, it's nice to be part of that and see them in the community as well, and they really appreciate the services we provide.
Excellent, excellent. Sounds much needed. So you're working to keep everybody else healthy. How do you keep yourselves healthy?
I chase 5 kids around. I'm back and forth to the hockey rink, and 2 dogs at home, and I don't do enough probably to keep myself healthy, but that keeps me busy anyway.
Good, that's great. Brendan, what do you do?
I have 2 young boys at home that I enjoy hanging out with. They make sure I get my physical activity in when I go home playing chase.
Good, so you both play.
Yep.
That's awesome. Well, thank you both so much for being on this show today. I think it's so helpful for folks to understand the value that you bring in keeping workers healthy, and healthy workers, healthy businesses, right?
Absolutely.
So thank you for your great work for our community.
Thank you.
Thank you.
Yeah. This is Gilbert Bowen, your host of the NMC Health Beat Show. Thank you for joining us, and we've learned today how to work safe. Thank you for joining us.